Andhra Pradesh Allopathic Private Medical Care Establishments Part 8 5 Nursery for Newborn. All nursing homes providing maternity facilities must also provide for a nursery for normal babies. H. Other facilities. There are three very important facilities that the patient requires. They are the pharmacy, laboratory, X-ray and ECG. They are a must for every hospital. It would be ideal to have them within the premises of the hospital or in close proximity. Other facilities such as ambulance services, high-tech diagnostic and monitoring facilities are to be considered as optional under the existing condition in our country. I. Special care units. The special care units dealt with are the post-operative wards, intensive care units, intensive care unit providing specialty care. 1. Post-operative wards. The immediate post-operative period is as the intraoperative period in determining the final outcome of any operative procedure. A number of studies have clearly indicated that this is one of the factors contributing to postoperative morbidity and mortality. The essential requirements are A. All facilities and drugs mentioned earlier under general requirements. B. Monitors. Monitors is the basic purpose of postoperative wards. The basic parameters like pulse rates, blood pressure, respiratory rate, and urine output should be monitored, and this does not require any additional equipment. However, it is essential for every post-operative ward to have a pulse taxi oximeter and an ECO monitor with a defibrillator. ECG monitor with a defibrillator. The big centers, in addition, may have capnography, ventilators, infusion pumps, NABP, temperature monitoring devices, and arterial blood pressure monitoring. Oxygen delivery systems. There should be there should be always be a crash cot available with emergency drugs and equipment as described in part 3 of general conditions. C. The most vital necessity of a post-operative ward is the presence of specially trained staff. The staff should have adequate knowledge of the possible post-operative complications and should be able to recognize them early and call for concerned doctor. 2. Intensive care units. Design considerations. The beds in an ICU should be laid out in such a way as to permit observation of every patient from the nursing station. The beds should have a firm base to permit cardiopulmonary resuscitation and should be movable easily. Provision must be there to alter height of the head and foot ends of the patient, and the plank at the head end must be detachable to facilitate endotracheal intubation when required. There should be adequate moving and working space around the beds. These units should be declared as restricted areas and attendants should be kept away. Adequate attention should be paid towards asepsis. B. Staff. A minimum of one trained or qualified nursing staff for 5 beds round the clock, and a duty doctor should be available round the clock. The staff nurses posted shall be well versed with the different equipment operation with the different equipment operation and should be trained to handle critical situations. An anesthetist, by virtue of his training in emergency care and being the best to maintain two vital body functions, that is, circulation and respiration, is the choice to manage the intensive care units with the help and guidance from the concerned consultants. C. Materials and supplies. All the necessary emergency drugs are as detailed in Part 1. General requirements should be made available. In addition to the essential equipment, the additional equipment required are a pulse oximeter, ventilator, infusion pumps, ophthalmoscopes, glucometer, and the resuscitation equipment. In other words, 1. Laryngoscope, 2. Endotracheal tubes of different sizes and connectors, 3. Oxygen cylinders, masks and connections, IV ammo bag, etc. Preferably, a generator should be installed as an alternative power supply requirement. Round the clock laboratory support is necessary. 3. Specialty specific intensive care units. Intensive care units dealing with a single specialty. Neuro care units, coronary care units, respiratory care units, and trauma care units are the best way to provide the intensive care services. The basic requirements are the same as general intensive care unit, and each specialty care units need to have additional facilities specific to the specialty, such as temporary pacing, critical equipment such as cardiac monitors and defibrillators for ICUs, incubators, and warmers for NICUs. Thank you. The rest will be continued in the next part of this series.